Hi everyone, welcome to the channel. Here we discuss medical videos and lifestyle. In this video, we are talking about reflux, or GERD, or gastroesophageal reflux disease. Now this is a wide topic, and we will be making future videos on things such as the root causes, hiatus hernia, gastritis, Barrett's esophagus, and proton pump inhibitors, such as PPIs. But in this video, we're going to just focus on GERD, or acid reflux. We will be focusing on the symptoms, the risk factors, the management, the investigation of GERD, and the lifestyle interventions we can all implement to make this more manageable and to have a higher quality of life. So let's get into it. So put simply, GERD is when that feeling of heartburn keeps happening. But let's get a bit more specific. So if we apply a system-based approach, GERD is a functional GI disorder or a functional gastrointestinal disorder. Another name for this can be a gut-brain axis disorder. Now, GERD is very popular, very widespread. There was actually a study done, I was reading about, that surveyed about 75,000 people across 33 countries all over the world, so over 6 continents. So it's a small sample, but over 40% of them actually met the diagnostic criteria for a functional gastrointestinal disorder. This just illustrates how common it all is. GERD is the most commonly diagnosed digestive disorder in the United States, and it's responsible for a significant economic burden in direct and indirect costs, and it affects quality of life negatively. Up to 40% of people in the US report symptoms occasionally, and up to 20% report symptoms weekly. So it's quite a problem for people. We're going to focus today on that part there in the illustration of the esophagus. That's where the discussion of GERD is going to be. So where the esophagus meets the stomach there. As you can see, there are so many functional disorders here that we can get into, but okay, let's stick with the GERD. We've defined where we are, and let's move forward. So as I mentioned, GERD is super popular. So the most common upper gastrointestinal diseases are GERD, dyspepsia, gastritis, and gastroparesis. So let's get into the definition. How do we define GERD? GERD is essentially caused by retrograde flow of the gastric contents through an incompetent gastroesophageal valve. So basically, where the gastric contents are shooting back up into the esophagus and causing all the problems that we experience. Another way of defining what it actually might be is a definition by the American College of Gastroenterology, and it defines it as symptoms or complications resulting from the effortless reflux of gastric contents into the esophagus or beyond, into the oral cavity or even the lung. So that's the main thing. An overspill of acid shoots up, causes continuous problems because of the constant inflammation. This causes then other problems, right? It can result in other issues that are caused by GERD, such as esophagitis or ulcers, which and also changing the cells into abnormal ones because they aren't getting a rest from all the constant irritation and inflammation. And eventually we call this Barrett's esophagus, which we'll talk about in another video. So that's the definition of it. So what does it look like? Now let's talk about the presentation. So the main symptom is heartburn. So it's the most common symptom. Burning retrosternal, so behind the sternum, or epigastric, right at the bottom of the middle of the rib cage. Pain which worsens on bending, stooping, or lying, and with hot drinks. And generally it's relieved by antacids. But heartburn, yeah, it's the main symptom that people experience. Let's move on to some other ones. Other symptoms can be categorized into esophageal and extraesophageal symptoms. So under the esophageal category, we have things like water brash, heartburn, dysphagia, things like that. Water brash is when the mouth fills with saliva. We could also get reflux of acid into the mouth, especially when you're lying at night, so flat, nausea, vomiting, and other symptoms. When we're talking about extraesophageal symptoms, I mean, these are things that manifest themselves outside of just the esophagus. So you can have worsening wheezing, you can have cough, you can have worsening of your asthma, for example. That can happen as well. So these are all things listed here that are extraesophageal manifestations or symptoms of GERD. One last thing to note is that if there are any worrying symptoms like, weight loss that can't be explained or difficulty swallowing really that's lasting for a little while, then these might make us think of other things and we need to get properly assessed. All right, now we get into the interesting part. So So we defined it, we defined what the symptoms are, but we haven't defined how to diagnose it yet. So how do we diagnose GERD? Well, it's a tricky topic, actually. There isn't like a 100% way of doing it. Not like, for example, a mole that you can confirm is cancerous because you did a biopsy. This is a little bit different. So although we defined GERD a few minutes ago, its diagnosis actually can't always be confirmed. Sometimes your doctor might not do anything at all, but rather try to give you a trial of a treatment, like with a PPI or proton pump inhibitor, which will then help us put the pieces of the puzzle together, right? So if your symptoms resolve, then maybe it is something like GERD. Or you can try and diagnose it with an endoscopy. So an endoscope is not a camera like the one here pictured, but basically it's a small, tiny tube that goes into the mouth, down into the stomach to see what's going on. Now, when the camera gets down into the bottom of the esophagus and to the stomach, it can see a few things. But the most important thing here to actually realize is that the highlight is that symptoms are poorly correlated with the endoscopic findings. So it's not completely correlated. So the frequency and severity of heartburn that you may be experiencing is not associated with the degree of damage that you might be able to see on the esophagus with the endoscope or with the camera. In fact, what can sometimes happen is that patients with manifestations of GERD, so evidence of GERD on an endoscopy, are actually asymptomatic. So they don't exhibit any symptoms, yet it looks like they have GERD when you look at it with the camera, right? So let's get into a little bit more of what we can actually see with the camera. We can see erosions, so we call that erosive GERD, but there can also be nothing seen, like I mentioned. And then at that point, we have to consider that to be called non-erosive GERD, so with no actual erosions there, meaning the mucosa is normal, but there is reflux symptoms going on. So just to piece that all together, sometimes we have symptoms, but we can't really see anything on the endoscope, or sometimes there's reflux, but no symptoms, right? So it's interesting to think about it. Now let's get into the management. So classic therapy for GERD is a PPI, so proton pump inhibitor. We'll make a video about PPIs, but essentially the aim of them is to suppress the stomach acid to reduce the amount of acid regurgitated. Depending on if anything else is seen on the endoscopy or how the actual history is, the PPIs are given in varying degrees. In general, about 30 to 40% of people don't respond to the PPI. When PPIs aren't working, then alternate medication is given. But that's basically where we are in terms of medication. So PPI and then alternatives. PPIs, they're given in enormous amounts, and it's the main way to treat GERD. But there is a downside to it. So it accrues about $10 million in annual direct healthcare costs a year. There's plenty of other stats. I won't go into them now, but PPIs are used very often, and sometimes we need them, but sometimes they're just issued blindly for various problems by practitioners, and it doesn't really solve the problem, yet adding to the costs. Hospitalizations for GERD, they increased by about 200% from 1998 to 2005. This is likely due to diet, weight, lifestyle, all of those things. But it just goes to show that, there's a huge prevalence of it, and PPIs are given, and we just need to put a bit more thought into it. So we spoke about GERD, what it is, how to define it, investigate it, and manage it. But what we haven't spoken about is actually the most important thing regarding GERD. So yes, we can treat it with PPIs. We can suppress the stomach acid. We can help in that way. But it's much, much more important to actually focus on the lifestyle factors and the risk factors that contribute to GERD. I mean, if we get on top of these things, then there's a good chance that we won't develop that acid reflux and we won't have a need for PPIs and all the issues that come along with that, and burdens that come along with that. So focusing on the risk factors, we have smoking, alcohol, coffee, fatty foods, big meals, obesity, hiatus hernia, tight clothing, pregnancy, systemic issues like systemic sclerosis, so diseases like that. There are also certain drugs like NSAIDs, TCAs, SSRIs, and surgery is also a risk as well, especially when we're talking about surgery that impacts our ability to swallow. So surgery for achalasia, for example, we'll make more videos about that, but these are generally the risk factors, and there are a lot of preventable ones there that we can focus on. So lifestyle factors that will contribute much, much more positively on our reflux than just simply treating it with a PPI and just carrying on with poor lifestyle. So, in summary, to focus on the lifestyle factor of GERD, these are some simple things that you can do. So, eat smaller, more frequent meals, raise head at the end of your bed, try to lose weight if you're overweight, try to find ways to relax, focus on some of those lifestyle factors, alcohol, smoking, things like that, coffee that we mentioned a second ago. And in general, so lifestyle and pharmacy, if they're not helping your heartburn, go to the doctor. If you have heartburn for most days, three weeks or more, then go to the doctor. If you have any other symptoms, right, things that don't really fall under the picture of GERD, so losing weight, getting sick, food getting stuck, difficulty swallowing, things like that, then that would be the time to definitely go chat to your doctor and discuss it with them. So overall, it's important to accurately diagnose and manage GERD, but it's just as important to recognize the epidemiological risk factors, the potential of GERD to overlap with other GI conditions, right? So this might not be that, and to consider the wide range of symptoms of GERD. Thanks for watching the video. Hope you liked it. Like and subscribe for more, and we will see you in the next one. Bye bye.